OT Life Hacker here. Hello. So we just finished 3 weeks of field work, and this is now my 4th week. Gosh, there's so much to say about the 4 weeks. So let's turn off the radio and start. So did I say 4 weeks? I mean 3 weeks. So for the past 3 weeks, I'll be sharing what I did so that those who are going into occupational therapy, their level 2A fieldworks, this won't exactly may not be the same for you, but this can be a little bit of a guide to show you what it's like for other students in fieldwork. Because when I was going in fieldwork, I wondered how much work we would be doing from the very beginning, and then at what point do we start picking up the pace? What does it mean to pick up the pace? How many patients are we going to see in the day? Are we going to see them by ourselves? How much help are we going to get? So I had all those questions, and I imagine a lot of you probably have that same question that also causes a big worry over fieldwork, right? So let me share with you my experience thus far. So I've been sharing it along the way, but let me just recap the 3 weeks. So in the first week, it was more of me observing. So it was kind of like level 1 fieldwork where you're more shadowing and observing. But the cool thing is that you do have the opportunity to be more hands-on. So you can actually be there holding the patient, because the OT is watching you, and that's what you're going to get to, right? You're going to be helping to hold the patient, assist in lifting them up and such if they need the help. And then you also can run in, get the supplies that you need to if you're doing acute care, which is what I'm doing. Run in, get the supplies outside the room, bring it to the room, and also help with the documentation. So it was actually in the first week that I started doing the documentation, well, bits of it. And then in the second week, on day 7, well, technically that's still the first week, but it works differently for all of us. So on day 7, that's when I started doing my first, or was it day 6? Sorry, day 6 is when I started doing my first documentation on my own. And then since day 7, I've been doing a lot more documentation on my own. So now I do maybe like 3 or 4 I document on 3 or 4 patients on my own, and I have cut the time from what took me before. It took me an hour to finish one patient's documentations, and now I have cut it down from day 7 to last week, week 3. I've cut it down to about 15 to 25 minutes I take per documentation. And so for the most part, it's like around 19 minutes that I take for the documentation. But again, the way that I do it, I mean, in the acute care setting, it's done differently from other settings, and your hospital, if it's in hospital, will be still different electronic medical charting that you'll do, records. And so I also have been seeing patients much more independently. So the occupational therapist, when I'm doing the orthopedics unit, which is a lot of like hip replacements, knee replacements, and some spinal stuff. So for those, I have been having more independence. Well, for the hips and for the knees, I've been having more independence, where the OT will allow me to go completely by myself. He'll come in, pop his head in once in a while to check in on me, and then go back to seeing other patients. And so I absolutely grew so much from that independence, being on my own. All the patients were fortunately able, much more able to do things on their own. And if they weren't, then I brought in the OT. Or if there were risks that I thought, this might, there's one patient particularly who had, there was a lot of complexities for this patient. So when I walked in, when we did the chart review, he looked actually pretty good. But then when I went in, there was a lot of problems that arose within that morning, and so he was having a really hard time. And so I asked the OT for help, and it was good that I asked for help. So the other thing is, make sure you ask for help within especially in the beginning when you're learning. If you're not sure about something, ask. I mean, they don't expect you to know it. Some supervisors might, and you have to gauge the supervisor. So yes, you may have higher standards put on you, but see if there's ways that you can get the help that you need, because it's really important to seek the help appropriately versus pretending like you can do it, going in and something happens. So it's very important that you advocate for yourself. All right, so I've been seeing since week 2, I've been seeing patients more independently, and I've also been seeing more of the complex patients, like those who just had heart surgery or brain surgery, because they will have more wires and tubes and devices attached to them, and they will also likely have more possible cognitive and more need for assistance, more physical assistance that they need. And I have been seeing in the ortho department, orthopedics, I've been seeing, I had seen maybe it was 2 to 4 or 2 to 5 patients, more so independently on my own, which is so cool. So it's basically, I go in the room by myself and he pokes his head in once in a while, and it's so awesome. I absolutely love it. And the patients, it's so cool. It's really nice because the patients are very sweet. And there's even a time that the patient asked me or a few patients had asked me if I had a contact card. I'm like, no, we don't. But it's so cool to be asked that and to be told how much it's like. I mean, you don't go there for a appraisal, but it's really sweet to know that you're helping someone. I mean, it's so cool to know that you're making a difference for someone. Gosh, I love it. Ugh, I love it. Okay, so yeah, I've been seeing patients more independently, and it's only week 3, and it's maybe average 3 patients, particularly if the patients are less in need of assistance. So many times we've been also going into patient rooms together, and then the OT leaves the room shortly after when he sees that I got the handle on it. So one of the things you can do to also show your initiative is to ask the OT if you can do some assessments, or be the one to talk to the patient more so, and that's what I did, and my supervisor was very accepting of that. So sure, you may not always have this. Again, gauge your supervisor. It's so important. Gauge your supervisor, the environment, all of that is very important to see how you should approach things. All right, so I'll talk to you guys later. Bye bye.